Dr. Nikolai Shalygin at St. Alphonsus says at one point, about 30% of babies within their NICU were born prematurely, one of them being born as early as 26 weeks, with no other reason than the mother having COVID-related complications. Hospitals across Idaho are overwhelmed and overbooked as coronavirus numbers continue to rise, mostly with unvaccinated people. And not only are adults facing the dire consequences, but now babies are too.
It's now trickling down to affecting babies, and the last thing we want is babies who are, innocently coming into this world, not knowing what they're coming into. They don't have a choice, but being affected by what's going on when when we have a preventable action that could be taken.
Dr. Nikolai Shalygin, who fills in at the St. Alphonsus NICU, says that recently they have noticed an uptick in premature births among women, most of them struggling with respiratory disease.
The easiest thing to do if the mothers are getting to that point of respiratory failure is to take the baby out, because then we can actually care for the baby.
And many of those women forced to spend weeks in the ICU separated from their baby.
Our job is hard enough as it is to take care of sick babies. When you add on to that the stress that the families are going through being separated from their baby in the NICU, and we are usually seen as the bad guys.
Doctors say the best way to prevent all of this is to get vaccinated.
For my small piece of it, to just encourage anyone who's pregnant, thinking about being pregnant, or really anybody, but specifically people that are thinking about being pregnant, to please get vaccinated, because it decreases your chance to deliver prematurely and to have complications from that.
Throughout the U.S. so far, only 31% of pregnant women have been vaccinated. And as of September 27th, there have been more than 22,000 hospitalizations and 161 deaths among pregnant women. Live in the studio, Michaela Ellich, CBS 2 News.